The reason I chose this is kind of always what I wanted to do. I love surgery. I wanted to take care of patients kind of through their life, from young age until old age if I could. And I love delivering babies. I mean, nothing's really better than that. So that's why I decided to go into this. We are a diverse group of physicians, which I think is great. I mean, you want, physicians with a different perspective, different ages, different genders. We've all been through this. I think it's nice for patients to have people that really kind of understand what they're going through, understand kind of the struggles that they're going through. It's nice for people. So we recommend starting routine gynecologic exams, pap smears, screening for cervical cancer at age 21. Regardless of, anything, you start at 21. If women are sexually active prior to that, we recommend yearly screening for sexually transmitted diseases, just as general overall health. No risk factors, we recommend starting mammograms at age 40, but doing kind of clinical breast exams in the office with your annual exams. And then colonoscopies at age 50. So the older you get, the more fun you get to have. And then DEXA scans are generally, the bone scans are around 65, but that can be very dependent on risk factors and everything else. It can start much earlier than that. So the biggest advances right now in gynecology are kind of really the minimally invasive approach to surgery, the robotic surgery or Da Vinci surgery, which I do, my partners all do, which is great for women. I mean, they can come in, they can have their hysterectomy. Some of them go home the same day or the next morning. The recovery time is incredibly shorter than if they had to have a big open abdominal surgery. Patients always come in very anxious about it, especially young ones. They've never had this done before, or maybe it's been 10 years since you've had it done. I always tell people, you've always made it worse in your head. We want you to be comfortable. We don't want this to be an unpleasant experience for you, and we want you to come back and get your screening done. So, do your best kind of just to relax. We will explain things, what we're doing. There's nothing really to worry about. I have so many, so many of my patients that I have kind of a connection with, that I, especially in OB, that's a big one, because you're seeing these patients for months. You see them, weekly or monthly for months, and so you really get to know them. So when you get to then deliver their baby, I mean, I just had one recently who kept saying, God, I was doing her C-section. She kept saying, gosh, last C-section, I just really felt like I couldn't connect to my baby right away. My baby, I couldn't see him. I just really felt like everyone else in the room got to see my baby but me. And, we just had this really cool moment. I delivered her baby and I showed her the baby over the drape. I said, hey, look up, here's your baby. You're the first one that gets to see her. And what a moment that was for her. And it's something tiny. I mean, it's something tiny, but to her it means the world. And the fact that I can do that is great.